Gender equality is a fundamental human right and an integral part of holistic social and economic growth and development. This noble goal can be achieved through acknowledging the intricate relationship between gender equality, sexual and reproductive health and rights, family planning, health and climate change, the most significant economic and social threat of this century. According to the 2023 Population and Vulnerability Report by the Population Institute, Uganda is the 13th amongst the 80 most vulnerable nations in the world facing climate-induced events. They include but are not limited to prolonged droughts, floods, landslides, windstorms, hailstorms and lightning, whose severity and frequency has increased over the past 10 years. These events, the report further states, are a result of, amongst other things, the unplanned production and consumption patterns occasioned by the demands of a very fast-growing population whose livelihood depends on the climate-sensitive sectors. The country is experiencing one of the most rapid population growth rates in the world, projected to rise from 48.6 million to date to over 90 million in the next 25 years.
The increase in population has a direct bearing on the environment. What we are calling climate change is now the final effect of the different actions we have done. And there is no single response to climate change. So, on the side of the Ministry of Water and Environment, we have a full-fledged department to coordinate all the country efforts to respond to climate change.
Actually, that is the important thing that we are talking about. But where is the position of the women? Where is the position of the girls? Because the effect of climate change is putting a lot of stress on the girls and the women. And there is no way we can empower girls and the women when we exclude those key components on women's health, maternal health, sexual reproductive health, and family planning access.
The population of women in reproductive age is big, and we come from different regions across the country. There are areas that have been seriously impacted by changes in the climate. We've heard about the floods in Uganda that will deny them an opportunity to seek for family planning services. But too, women have to travel long distances to seek for the services. And if areas are degraded, then they will have no access to the health facilities to seek for family planning services.
Kati omukazi ebiseera ebisinga abasajja tebakikiririzaamu kyakugenda mu famire eyebbabwa ebbi ayagala adduka eddakiika 2 akomewo amusangewo. Kati olugendo ke luli wala abakazi kigenda oluusi okujja ng'akatego kamukwatiddeyo ng'afunye olubuto. Kati nze nganze ekyokulabirako kye nnina ku lwange nali njagala kuzaala abaana 6. naye abaana bano abana beeyongeramu lwa mbeera eyo.
The extreme weather conditions also escalate social, political, and economic tensions amongst the communities, producing different forms of conflict-related sexual violence. In fact, many families, for example, force their daughters out of school and marry them off before even reaching puberty, compromising the health and well-being of both the child mother and the baby. Nearly half of all pregnancies worldwide are unintended, a trend that the UN Population Fund describes as a neglected crisis. This means that when people are many, they need more resources to thrive, which usually leads to overutilization and consequential depletion of natural resources.
There are some species which we are known locally to cure our people without going to the hospitals or the health centers. Most of those plants, like the trees and the shrubs, those are almost going to extinct. You find that we incur a lot of diseases which would have been cured if there wasn't this effect of climate change. And even this climate change has affected the agricultural sector. such that food production is now low.
Omulimu guno gw'ensujju tuguluddemu nga tulima yiika emu yiika bbiri tufuniramu ddala obutaka wansi wa bukadde 5 naye kati okulima kwa leero kutusaze olw'ensonga embeera y'obudde yakyukakyuka enkuba ebadde etandika mu Gw'omunaana neekomenkereza nga mu Desemba era eba ekyatonnya naye kati yatusuula kati banka etubanja abakozi betwakozesanga mu nnimiro bakyatubanja twali tubala kirala ate ekirala ne kikola ki ne kiyingiramu.
But even the heavy rains and forceful winds can be as disastrous.
Now, this is a health center with over 200 outpatients, around 100 inpatients, all access services from one unit. We had medicine flooding, we had documents and equipment destroyed, and all those services were suspended for a long time, to the extent that it was closed and shifted. So when people fail to access services, the mortality rates go high. People will give birth like no man's business because they cannot access the services that they are required to get.
We are also scared because the population of the youth between the age that is not really productive up to around 24 is half the population of our district. Yes. So just assume that if that population also multiplied with each one of them delivering only 4 children, then in some years to come, we may have Buyikwe having a very huge population. So it is a concern that while we are talking about family planning, there is a way it should be linked to environment. But we have not had an opportunity for the country to guide on the best way that unique geographies and service areas can be integrated. That when I talk about malnutrition, I should be able to connect it with the environment.
Regenerate Africa, a Uganda-based NGO, has been at the forefront of advocacy efforts to encourage policies and programs that directly address intersecting challenges of climate change vulnerability, population dynamics, and gender inequity. It is operating in Sibukunja Sub-County Zitwe Parish in Buyikwe District to fast-track the integration of sexual and reproductive health and rights into climate resilience actions in Uganda using the model household concept.
We're trying to integrate population dynamics and health in terms of sexual reproductive health and rights stroke family planning, but also looking at issues of the environment. So we do a lot of awareness from the villages to the sub-counties, even till the district, to help them understand this concept because they are our custodians. So in each model household, we teach both the man and the woman that the number of people in our environment has a very big effect on the number of resources in that environment. And that family planning is not just about using the methods, no. It's a voluntary effort that they have to take on to plan for the children that they can be able to take care of. So we give them seedlings so they can be able to plant different varieties of vegetables. And on top of that, we encourage them to plant indigenous trees, but also fruit trees, because we want to encourage the issue of food security and nutrition, because we're also looking at maternal and child health and sustainability.
Ekyo kituyambye tusobola abaana okubawa space. Ekyokubiri, mukyala ng'afuna obudde obuwummulamu okusobola okulabirira omwana asooka n'okulima emmere etumala nange. Nina yiika 3 ku 4 era kivudde bulungi n'abavubuka bangi bajja mikwano gyange ne bakirabe. Kinsimbya ebibala bino nga kooko n'emiyembe banyambye obutonde bw'ensi. Kubanga kuno okwaffe twalina ebibira nga biri nakyo naye abantu bongedde okubitema. Nze we nakiraba ng'ekyo kwe kusimba emiti nga bwe baze batukubiriza nange kennyini gye ntambuddeko.
Successful community members like this one are called PHE champions. They are supposed to live an exemplary life and to train and support 5 other households to also adapt the PHE practices. With all the aforementioned, it is clear the drivers of conflicts and of vulnerability to climate change are multiple, complex, and oftentimes cyclical, making it difficult to analyze their differentiated impacts on family planning and sexual and reproductive health and rights in isolation. There is need, therefore, to build sectoral rather than program-based adaptation strategies and actions and integrate them in the climate action programs right from the grassroots to the national level.
As a sub-county, we develop those policies. Like, let me say, if one is caught cutting down trees without our consent, what are the repercussions? So those policies passed into our technical planning committee as the sub-county. Then we passed them into our council meetings and we brought them to the district.
Through the office of the Prime Minister, the government had developed a national disaster risk management plan to incorporate provision of a minimum package of sexual and reproductive health. And the other thing is also to popularize, climate change and SRH have not been very common topics. So it's something as a Ministry of Health we are taking up, especially through this Department of Reproductive and Child Health, to ensure that these conversations become more popular, more common.
So one of the biggest challenges in terms of implementing these integration aspects is the issue of translating our plans into actions. Some of the climate change mitigation and adaptation issues are not given much attention. So there is a mismatch between our intention in terms of planning and then when it comes to actual implementation.
But the intersectionality is lacking. There are some models which have been tested that cut across sectors like the population health and environment integration that can actually work when both financial and human resources and all these capacities are brought together. So we have to walk away from working alone. We have to move with the sectors. The funding agencies, including the donors, have to be convinced that it is no longer working to move into silos. We need to see the governments take health and the subsectors in there to be a priority in the national climate change adaptation plans, including designing responsive actions and budgets and implementing this with an intentional focused gender lens for scaling up the best practices that include multi-sectoral approaches. Let's move it from the talking into real actions.